Heart Business on Heart 1027 with Moneyweb.
Now, there's a new study that is highlighting the alarming health impacts of the overconsumption of sugary drinks, and that would include, obviously, rising rates of obesity and diabetes. I want to unpack the findings of this in a little more detail and explore some solutions, and also look at the impact of sugar on the South African economy. I'm in conversation now with Dr. Patrick Ngassa Piotie from the University of Pretoria's Diabetes Research Centre. Doctor, good evening to you. A very warm welcome. Let's start with the key findings of the study on sugary drinks and the health impact on South Africa. Fairly dire from what I've been able to discern.
Indeed, Jeremy. The study that was published on Nature, which is quite a reputable publication internationally, have shown that there is quite a high rate of diabetes related to consumptions of sugary drinks. And indeed, they've assessed data from 2 points in time, and they found that there has been an increase over time, not only globally, but also in South Africa.
And that almost runs against conventional wisdom. It does beg the question, does it not, as to why drinks like this still remain popular despite the well-documented health risks and those outlined in this particular study?
Yeah, unfortunately, we have now to mention the commercial determinants of health, which is the power of industry in terms of marketing, in terms of manipulating the way we live, the way we eat, the way we exercise. So there is a big machinery. I don't want to mention any company, but we all know the ones that are usually culprit in these kind of circumstances. They put a lot of money marketing for those products, and once they grab the individual from a young age, as we know our kids are already drinking those drinks, it becomes difficult to disconnect and to change those habits.
And is this also, in your opinion, a failure of regulation?
Yeah, definitely. When we are confronted with situations whereby there's a whole industry driving these poor healthy habits, we need to counterbalance it with not only policies but regulations, and also obviously monitoring those policies. So indeed, we think the government could do more and to protect the lives of the people in South Africa.
But inevitably there is going to be a lot of inactivity as far as that is concerned, given the amount of money that the industry contributes to the fiscus.
Indeed. Like you can see from the background around the sugar tax, there was a lot of lobbying from not only the sugar industry, but also those companies to not have a tax as aggressive as the healthcare advocates wanted. So as a result, although the tax that is actually in place is producing good results, we could still do more in Mexico and elsewhere, where they have managed to really drastically change the consumptions of those drinks in their countries.
To what extent so far then, and let's talk about that sugar tax, has it impacted measurably, if one can work that out? Initially it was introduced to curb consumption. Your suggestion is that it's doing a good job, but obviously not enough.
Yes, that's how we can summarize it. The early research is showing that we might have managed to curb by half the consumption of sugary drinks in South Africa after implementing the tax. But as you can see from the statistic around the prevalence of diabetes, we are still experiencing new cases. As you said in your introduction, we have a lot of obesity. Yes, we're not going to blame all on the sugary drinks, but it's part of the ecosystem and the environment. So we think that by being more aggressive on the sugar tax, we could do more in terms of preventing more cases of diabetes down the line.
What do you mean by being more aggressive on the sugar tax?
By increasing the tax. That's basically what the health advocates are asking for. I believe the government was quite conservative. There were some fear-mongering about losing of jobs and stuff like that. But we believe that the tax can be increased in order to make sure that people stay away from those drinks, are discouraged by the pricing of those products, and therefore will maybe be guided towards other options. But yes, it shouldn't be isolated. We should do a lot of education with in the countries, from the schools to the working adults to everybody. There should be a lot of sensibilization around why we need to adopt healthy lifestyles and healthy diets.
You make a compelling point, but it's also difficult, surely, for policymakers who've got to strike a balance between supporting local beverage industries on the one hand and prioritizing, as you're suggesting, public health.
Yes, it's a challenge, but we need to look at it differently. For example, we had the same long debates when we wanted to introduce the tobacco policies in South Africa. I'm sure you remember the industry were talking about loss of job, a lot of loss for the economy in South Africa, but none of that materialized. On the contrary, you are having healthy populations. People will be contributing to society longer and will be healthy longer, and obviously will be making a lot of savings in terms of healthcare. So those things tend to balance each other, and I think in all time, public health should be prioritized, because what would be good for us to have a population of sick people but still have a, in quotes, strong economy?
And I think you make a very important point in that respect, but I wonder to what extent it's been quantified. Has any work been done on the economic impact of sugar drink consumption on the healthcare system more generally?
I'm not aware of any, but by proxy, we will see that the impact of diabetes, since even the paper made the point that the challenge is having type 2 diabetes from the consumption of those drinks, the impact of type 2 diabetes of an economy is very big. You can see the example in the United States, where you have a lot of obesity, a lot of diabetes, and they are putting a lot of money into preventing the complication from diabetes. In South Africa, we are very far from it. The number of deaths is quite high. Diabetes is now the number one cause of death in the country. But if we are to quantify, I'm sure I've seen a study recently, actually last year or so, whereby they say almost 12 billion of the budget is expected to be spent in preventing complications from diabetes, in solving or curing complications from diabetes. So you can see already there are some signs of a big impact on the economy of the country and obviously on the government budget.
Well, a stark warning certainly being sounded there. Dr. Patrick Ngassa Piotie from the University of Pretoria's Diabetes Research Centre, thank you very much for talking to me tonight.
Heart Business on Heart 102.7 with Jeremy Maggs and Moneyweb.